rapid access to comprehensive oncology data and survival analysis. This is the OncoToolkit.
Hello everyone. Today I saw a patient after thyroid cancer surgery, and it raised an important question. Although the operation was successful, determining the patient's risk of recurrence and deciding how aggressively to manage follow-up isn't always straightforward. Let's use the ATA Thyroid Cancer Risk Stratification Calculator to walk through this case together. Our patient is a 46-year-old woman who recently underwent total thyroidectomy for papillary thyroid carcinoma. The final pathology showed a 2.4 centimeter intrathyroidal tumor with 3 small central neck lymph node metastases, the largest measuring 0.3 centimeters. There was no gross extrathyroidal extension, no distant metastasis, negative surgical margins, and no aggressive histologic features. Let's enter these findings into the calculator. We'll begin by entering the patient's tumor characteristics based on the final pathology report. Next, we'll complete the remaining clinical variables, including lymph node involvement, extrathyroidal extension, vascular invasion, and other pathological features. The calculator then applies the American Thyroid Association risk stratification criteria to classify the patient's risk of structural disease recurrence. Here are the results. Based on the information we've entered, this patient is classified as intermediate risk according to the ATA Thyroid Cancer Risk Stratification System. This category indicates an increased risk of structural disease recurrence compared with low-risk patients and can help guide decisions regarding radioactive iodine therapy, surveillance intensity, and long-term follow-up. Rather than replacing clinical judgment, the calculator provides a standardized, evidence-based framework to support individualized patient management. Just below the results, you'll find the clinical summary. This section provides a concise explanation of why the patient falls into this particular risk category, making it easier to review the assessment and communicate the findings during clinical practice. If you'd like to see exactly how the assessment was derived, simply switch to the calculator logic view. This section breaks down the individual clinical criteria used by the calculator and shows how each finding contributes to the final ATA risk classification, providing greater transparency behind the decision-making process. For convenience, you can copy the clinical summary directly into your clinical notes with a single click. You can also save the assessment for future reference and revisit previously saved cases whenever needed. Finally, be sure to scroll down to the reference table. It summarizes each ATA risk category, explains its clinical significance, and provides supporting guideline information to help place the results into the appropriate clinical context. If you'd like to explore more evidence-based oncology calculators, visit OncoToolkit for a wide range of clinical decision support tools. Thanks for watching, and I'll see you in the next clinical case.